Okay.
Dah kan?
Recording.
Dah kan?
Okay, recording.
Recording.
Okay.
Okay, so if
Tapi Anita dah hilang pula.
Anita sebab dia nak tukar laptop. So if let's say you want to do the 10 months intensive,
Oh.
so maybe we can you can write out a plan for you all. What kind of tuition you need for which part. Then the going out one you have to put in a plan somewhere lah.
But I mean, in this COVID situation, it's almost like impossible, right? I mean, for us to go like for attachment.
Yeah, but then using that,
I think like after Raya, maybe after everyone is vaccinated, then
there might be hope lah, because the government also need to pretend that it's doing good, right? So
yeah.
we probably will do something like that lah.
Did you take your vaccination? Did you take your vaccination?
Yeah, I got ready. One of the first.
Oh.
I tak adalah pusing-pusing malu.
Okay.
It aches a bit, but otherwise
okay lah, so far okay lah.
Okay je. I think my joint pain is more painful than the jab. Don't worry. I sedih tengok like so many of the nurses.
But they said
the staff not taking, so many of them not taking, isn't it?
What?
Yeah, I think because some of them they are master students, so their names are in Sedang and also in HPUPM.
Yeah, that's one thing.
Like Wani kan? Wani ke? I think
Wani, Nicole.
I think their names are in both hospital, but they took the Sedang's one.
Oh, I see. That's
So
okay
I think
lah.
most of them like macam master student yang ada 2 nama lah. So.
Not our staff lah. I was scared whether the staff takut.
Tak kot.
Okay lah.
Okay. Anissa je.
Okay. So I suggest write out a plan and what tuition you need for which one. You all think about it and give a timeline kind of thing, and then you all tell lah. Then see what I can do in this one, because I think I cannot listening to what this one said makes sense also lah, what Rosanna said.
Yeah.
So maybe,
but I feel like right now I don't even know what kind of tuition that I need.
Yeah, I know, but at least maybe we can do a framework of what she wrote. I asked her to write for me. She said, she never wrote it out.
Yeah.
Like very clear of the whole syllabus, so she's very clear lah what is required and what is not.
Yeah.
I also haven't messaged Michelle yet to ask.
Even the stations also are still confused. What are the stations?
Yeah. That's why
the time.
I hear her talk like she's so clear of the stations.
Yeah.
So quite impressive lah. And she said exam so long ago.
Yeah, in 2017, right?
Tapi macam
2017 kan?
And still fresh, because she gazette same time as me. She got the gazettement letter same time as me.
Oh. Okay.
It's good lah. Whatever she focus, she put in the effort, means she'll be okay one. But what she want is what she want, not that. So use her knowledge. Tap into her. Okay, so what we can do is you'll write out the plan. Hidayah's frozen.
Sorry.
Okay, so write out the plan that she wrote, and then we can work out together lah. What can we do? How to put where and all that. Okay. I also a bit lost a bit. Okay, so shall we do a comp session?
Okay. Anissa said to be the candidate. The candidate role player.
Balik awal semua. Pendek je. Question dia. Can see?
Not yet.
Okay, yes.
Yeah. So Aniza, you are the registrar or we
Yes.
call the neonatal unit. You inform about a newborn baby diagnosed with lower limb deformities and was diagnosed with congenita. My spelling is wrong there. The mother for fetal distress. Apgar at birth was good and she weighed 3.1 kilo. However, was found to have limb deformity. Mother had antenatal GDM on diet control. Her first ultrasound in the first trimester was normal and never repeated due to lockdown. Mother is a 35-year-old teacher and father is a 38-year-old clerk. So your task is to explain, break the bad news to the mother.
Okay. Who become the mother?
I.
Let's try.
Like this question means like the baby is newborn, right?
Yeah, newborn. So
lah.
not imagine I from the day she was born, but the thing is you had no antenatal scan and you have no idea, the mother have no idea that this is going to happen. Okay. So I'm going off my camera because then I can menjiwai the character.
You ke? Okay.
Go Anita.
Okay. Good afternoon.
Okay.
Good afternoon, Miss
Good
Ramli.
afternoon.
Okay.
Yes.
I'm Dr. Aniza. I'm one of the doctor treating your baby.
Yeah, hello.
Okay. Congratulations on your newborn. Okay. How are you feeling now?
Actually, I'm very tired and I'm very worried actually. I don't know what's going on with my baby. They told
Yeah.
me, they said something's wrong and I haven't seen my baby yet.
Okay. So that's why today I come to talk about your baby. Is there anybody want to be with you? Your husband maybe?
I want my husband to be here, but I was told that due to COVID, he can't come in.
Okay. So for now, I will talk to you about your baby first. Is it okay?
Yeah, will you explain to him later?
Yes. But for you, for now, you want to talk about your baby?
Yes, I don't know what's going on actually.
Yeah. So maybe we can tell you and we can hold another session with him later too, if you want.
It will be nice.
Okay. So tell me what the other doctor or the others what you have understand so far about your baby.
Yeah, what I know is just that I went in for Caesar because my baby wasn't breathing so well. I think
Yes.
it was in distress. So when I went into Caesar, but because I was still conscious. You see, when they took out the baby, then they were talking, mumbling something about something's not right and all. Then they called the child doctor in. And after that, I don't know, I couldn't hear much, but then the nurse didn't show me my baby and they took the baby off. And the nurse told me that the doctor will come and explain to me because there's something wrong. So I really don't know what's going on.
Oh,
She
so you haven't met your baby yet till now, is it?
No, I have not seen. I don't know what's going on. Is she okay?
Okay. What actually happened is actually your baby have a condition which we call as Arthrogryposis multiplex congenita. Have you heard of this
No, doctor.
disease before?
No, it sounds very scary, doctor.
Yeah, it's the sound is the name is quite long. So what I can easily tell you that this term means is actually the arthro is means your baby joint. The joint of your baby is kind of stiff. It's kind of rigid joint. Your baby had a rigid joint which happened at birth.
So you mean is it because of the delivery, the way they took out my baby and the joint became stiff?
No.
The
Is
kids the
this
fault?
condition actually happened at birth, and it's not anybody's fault. It's not your fault. It could happen to anybody actually. And in fact that there are other babies in the world. The rates is about 1 in 5,000 baby actually for this thing to happen.
So why?
So don't feel any guilty because it could happen to anybody. And actually this condition, it there are some say that it could be due to the lack of space in the uterus when the baby in the womb, or because of some infection when the baby in uh when the baby in the womb lah.
Is it?
Hmm.
Oh, but I had diabetes, but I don't know. Is it because I'm
Yeah.
not very tall? That's why there's not enough space for my baby to
No, no,
grow.
no. Don't worry, mom. It's not your fault. It's not anybody's fault. It's actually, it can happen to anybody. Yeah, as I say that there are various possible factor that could lead to this to happen, but it's definitely not anybody's fault and definitely not your fault. Don't feel guilty about it. Okay.
Okay. Is
Hmm.
she okay? Otherwise, what other problems does she have?
The actually for your baby, the one that impaired is the baby motor function. The motor means the movement. Otherwise, the sensory, which the feel, your baby could feel like any other child. She can feel warm, she can feel hot, she can feel cold, she could feel pain, and your baby will grow up uh, with the normal IQ as any other child would be, but it is the problem is will be for your baby is it will be for the motor function,
What
means the
do you mean
movement, because as yeah,
movement,
sorry,
huh?
yeah, because as we said here earlier, this condition, arthrogryposis, is actually affecting the baby joint, where the joint will be stiff, rigid. So when your baby tried to move, it will be hard on her.
So
Yeah.
all her joints are affected, is it? All her hands and legs and everything?
It's more than one joint. More, it could affect uh, her mouth, her mouth movement, her hand movement, her her leg movement. So when she grew up, she could have some problem with walking. So for now, when the baby came out, so the first issue that we would encounter is with the sucking. So when her mouth movement is affected, so she will have some problem with sucking.
Okay.
Mm-mm.
So she can't breastfeed then.
She can breastfeed, but then her mouth movement will be slow to suck the the breast lah. So the breastfeeding would be have some issue. But don't worry, we have a good team here to help out actually.
Okay,
Mm.
doctor. But does this mean you said her IQ is normal? That means she can go to school, right? But the thing
Mm,
that you said that her movement will be a problem. So
yeah.
can she walk later? Is there anything I can do for her? Is there any surgery? Is there what can I do for
Mm.
her? I mean, can she actually get married or walk around, go to college? This is my first child. I don't think
Oh,
it's
okay.
fair. Hmm.
Mm. Okay. Actually, for her to learn, yeah, the IQ the IQ of your child would be normal, but then for her movement she might need some help with that. So what we can offer for now is, for her movement, we have a good team here. we got orthopedic, we got physiotherapist. For the movement, our aim now is to reduce the stiffness, because if the stiffness, we didn't help with the stiffness, the joint will become more stiff, and later on it will lead to some contracture there.
What is
Mm.
contracture?
So they are, what is it? Sorry,
It's contracture.
means the joint become more stiff and hard to move around later on.
Okay.
So what we can help is we can offer some physio which we do some exercise to help the muscle movement, and then help to reduce the stiffness. And then later on, we with the help from the orthopedic team, we could put your child on braces, functional braces, so it will help her to later on to move around. And yes, she could go to school, but then she would need help for her movement actually.
Okay. Is there anything else? Okay, you told me that she will need the orthopedic doctor and she will get the physiotherapy, and she has actually will have some swallowing problem. And her
Yeah,
IQ
for the swallowing part, for now it would cause some problem with the nutrition, because when the child cannot swallow, she couldn't get the nutrition that she would need. So that's why we need to monitor her condition, so that if her swallowing needs some therapy, where we could offer some oral motor, which we could offer some exercise for the oral, for her mouth movement. It could help with her sucking and help with her nutrition improvement later.
Okay.
Mm.
How is her face, doctor? Is she like looking funny? Is she looking like those special children I've seen on TV?
The special, oh,
How is it?
actually,
Otherwise, is her heart beating okay? You said
oh, okay.
her IQ will be normal, but is there any other things that I might be worried about?
Don't worry, because her internal organ would be fine. It's just that the external one, her joint, is some kind like the case. When the internal one would be normal, she won't have any problem with the um, bowel motion, heart problem, or anything like that.
Okay. I don't know, doctor. This is too much, a lot for me to absorb. I don't know.
Yeah,
Because
I know
I'm
it's.
just a teacher, and my husband is just a clerk. We don't have that much money. I don't know how we're going to, do all these things. It's not going to be easy.
Yeah, I know it's gonna be. It took a lot of. This thing would be quite shocking things for you. Yeah,
Yes.
furthermore, it's your first baby, is it right?
Yeah. Yes.
Yeah, I think later on maybe we could suggest you a few groups that support these children, where there are some parents with the same children with this disease that could offer some help, that could offer some guidance regarding this. We will introduce you to them later on, I think.
So after
And
this, what happens
yeah,
after, like, how long when can I bring her home? And after I go home, what's going to happen?
yeah. Actually, after this, your child can go home with you after after being discharged. But then you need to do for after you have already know regarding the how to do the physio, and which you can do at home. But then she would need regular checkup to come and to look for her growth and for her growth later on, and also for her any problem with her movement, whether it's improved or is it worsen.
Okay. Okay, doctor. I think I get a picture of what's going on.
Don't worry. I know this is your first time hearing about your child. I think if you maybe you can do some reading about it and get if you have any further question, we could arrange some other session with you and your husband together later to explain further regarding this.
Yep. Thank you, doctor. That would be nice, and I hope I can see my daughter soon.
Yeah. Okay.
Okay, thank you. Stop you there.
Betul ke saya punya info macam ni betul je.
You did quite well. What do you all think?
Macam info macam ada yang tak betul je. Tak
Huh?
Ada yang tak betul ke betul Citra? Info saya.
Info.
Aku nak tengok timing tadi. I mean this
9 minutes kan?
communication is supposed to be 9 minutes
9 minutes. This was longer actually.
I think it's a bit long lah.
Yeah. I wanted to just study it a bit to get more info out. Okay. Introduction.
Slow sangat.
Huh?
Slow sangat. Dia macam tak payah dengar.
Actually, no, I think it's okay because if it hits 9 minutes, they will stop you and say it's okay. I mean, you're done here lah. Okay, introduction. What do you all think? Introduction. How did she introduce herself? Was it okay?
I think quite okay. I mean, she introduced herself, and then she.
They congratulate, and then
then she offered to, I mean, to have someone else in the room.
Nak try.
Once line lah you.
Tak dengar.
Nah, dia patah macam tu.
Kena tutup video lagi.
Try and see.
Hello? Dengar tak?
Dengar.
Okay. Okay. I think the introduction is quite okay. Itulah. Cuma I nak tanya Dr. Citra, macam in this type of communication station kan, with the yang breaking bad news, macam is it okay yang kita macam ada yang kita congratulate on the newborn babies tu?
Yes,
macam,
yes, because
boleh je kan?
Yeah, it's still a good thing that she got a baby. You cannot like, I mean, the baby is still alive, first of all. So only that, yeah, maybe you can say introduce yourself. She very good that she asked what you know so far. Can you just tell me? Then you get her part of the story, so you can imagine her whole anxiousness and how was the scene. So then you get the picture what is her concerns now. So and when you congratulate her, after that the mother said she don't know whether the baby is okay or not and everything. Then I would actually say that actually I have examined your baby and your baby is doing very well. She is breathing on her own. She doesn't need any medication to help her heartbeat. So you want to reassure her that your baby is stable. So now the only problem that we found, because she doesn't know what was it, right? So you did tell, but maybe you can emphasize more of how well she is. And the only small problem that we found, that she has this limb deformity lah. But I like the way you explain that it's stiffness and it's that's what's going on, because deformity may not be easily understandable by everybody. So when you say stiffness, you get a picture, the stiffness of the joints. The only thing that it doesn't occur at birth, Aniza, kan? Because the word
from
it's already
it's
already in. Yeah, because from the in the womb lagi kan?
Yes, in the womb. So at this point, actually, I would try to explain that what actually happened and how this happens lah. So sometimes you might get a diagnosis that you don't really know so well. Let's say because now you got this case, so you kind of know. But if let's say you don't know, then you have to be vague lah. So it's okay. In the 9 minutes will also pass by being vague and being compassionate. But then you can also still be like, we are not so sure, but I would like to find out further. And once we get a diagnosis, we'll get back to you. Or else this is something that I am not familiar with, but I have consulted my teams that have expertise in this area like that lah. Okay, so the best is to be honest lah, and then they'll say, because if you make up stories and make up signs also is not right. So you're supposed to tell what you think and then be compassionate and be truthful lah, as much as you know. And then you say, let's say you don't know what is this AMC all about, then you say you will get your specialist involved and you will consult, and they will come and review and give you reassurance again lah. But at this point, your baby is very well and all that. Okay, so and this limb deformity is not going to affect your child's condition at this moment lah. But if you know, then you must explain further. So if you know, you tell that this is intrauterine. So most likely happens when there is lack of movement in the uterus at the early stages of pregnancy. This can be caused by mostly reduced fluids in the amniotic sac, either due to leaking, or generally it just doesn't have enough fluids, or else there could be a neurological cause, which is the problem in the brain that makes the child not, or the spine where the child does not move the low legs as much. That's why it becomes stiff. Or else there's a connective tissue problem as well, that some rare cases where children develop this. So if you understand the disease enough, you must try to explain the possible etiologies so that you will actually follow through and tell that this is what we're going to investigate to find out the cause of it. Okay, and then other than finding out the cause, you want to investigate, because you must tell that we're going to do some tests, we will take some blood, okay, we would probably need to do an MRI. So those things, I think we could have elaborated a bit more lah. So those things can actually give you more marks.
Okay.
Okay, so then the investigation, because this is sporadic mostly and you're not so sure what is the associated symptoms, and usually breaking bad news with some deformity, we'll say that we will look into each and every organ that she has. Is there, if there's any kind of problems. Yeah, so if you say that, if there's any abnormality, anything we can detect, we will do further investigate if needed lah. Okay, to make sure that every part, because the mother raised that concern, whether my child's heart, the brain and all that. So you must address that concern. The main thing about comms is not how much you know about the topic. Don't get panic because of that, but it's actually how you communicate what you know and what are you going to do about it. So let's say you don't know the diagnosis, is you don't get panic lah. That's all I want to say. Okay, then, but her compassion, Aniza's compassion, and the way she expressed empathy and she recognized the mother's this one is very good. Okay, maybe a tad bit slow, but but the mother also was a bit slow in this one, like very melodrama a bit just now. But yeah, so at least you show empathy, you got pauses, you have to breathe, you let the mother think, and then you have to intermittently ask the mother, do you have any questions? Do you follow me so far, like that, So, but in your plan, always you want to explain, you have to have a flow. Introduction, find out what the mother knows, ask if anybody else want, then see whether is she comfortable in this room, do you want to go somewhere else, or like those kind of things. But this is difficult because you're doing online, right? But if let's say it's face to face, then you will actually feel the environment, whether it's suitable or not. Are you comfortable sitting and all that? Okay, and then next you go to what mother knows. Then once you explore mother knows, then mother will express some kind of her concerns. Then you address those issues. Then you explain one by one the things that you have to tell. Okay, so always have a point system. So etiology, everybody wants to know that, right? So you good that you gave the how the incidents. That's very good to have. If you know, if you don't know, it's okay. But if you know, you should tell. So common things like hypothyroidism, G6PD. In the UK one, you cannot know everything lah. But whatever you've studied for your exams, and it's like commonly asked, then you should just know, make sure you know. Okay. Then after that, but it's not going to carry that much of marks. Mostly it's the facts in the thing that you want to convey. and they want to see how you're going to manage and find for the problems and give care. So which she had, which Anissa had mostly, but I think what we can improve is just the flow of it and bringing back the mother to the points that you want to tell. Okay, so how would you do that actually? Let's say now the mother, we go back to that scene where the mother is, you already told the mother said, yeah, delivered, nobody told me. And then how are we going to go back to explaining these points now, the etiology? Because the mother already said, then you say, don't worry, it's not your fault and all that. So how are you going to go about? How would you rephrase the words?
Phrase the words. Yang pasal yang concern.
Yang, is it my fault? So you
to explain the etiology ke? Yeah.
Etiology tu.
Yeah.
Oh yeah. This condition actually, the stiffness of the baby joint from when the baby is in the womb, where it could happen due to the limited space or any.
Hello? Hello? Hello?
Some kind like genetic test, Dr. Citra.
Actually, some do.
We should kan?
We should
But it's mostly sporadic. For this
Macam
condition.
But then usually we did refer to genetic term juga lah.
Ada juga, tapi not in Malaysia lah.
Not in Malaysia means like in Malaysia we don't refer to genetic, is it?
It's not routine actually.
Oh, I thought
it's not a routine, Dr. Sutra. Itulah.
What I know, I've seen very rarely, but I don't see everybody. Let me check on that.
But in this we did refer lah.
I think we refer because I think Dr. Zu start suspecting because of we suspect yang dia ada problem dengan swallowing, coordination semua tu kan. We are afraid of that jugalah. Tapi I don't know whether this is routinely done or not lah.
But when I read about it, I see everybody actually do genetic tests, but there's no clear specific test. So what genetic test, chromosome XY, XX, like that, is not going to give you much answers. So that's why I don't know what panel. Everything. Pandai kau.
Like exome study, kalau dalam Nelson tu. In Nelson it says CGH array or exome study.
CGH array Oh, exome study is like the whole thing lah kan.
Kalau
invite lah kan, macam invite tu lah. Exome study.
Invite tapi invite specific. I mean the panels depending, right? So maybe then that's a brand lah. So okay, we should use that term then. Exome study.
And then Dr. Sitra, because I refer to Nelson. So in Nelson, they said the diagnosis is mainly clinical based on the characteristic symptoms and clinical evaluation. But they also suggest like nerve conduction or mass biopsy or EMG. So it may be needed lah to determine the cause and can help to diagnose neuropathic or myopathic disorder. So like do we do in all cases or in selective cases?
In Malaysia, we don't really do it. From my knowledge, we don't really go all out like that to find out the cause. Kan? As far as I know, I'm not so sure. But
I think maybe they will see based on the baby's condition. I mean from babies to babies because we know one of the macam types tu it can be associated with macam syndromic kan. And then when syndromic, usually it can be associated juga dengan neuromuscular disorder. So kalau kita suspect tu, maybe baru kita hantar ke macam mana? I don't know.
Are you talking about for exam or are you talking about for daily clinical?
I think for exam juga lah. Macam I don't know whether this macam in this type of communication tu, do we have to go to that extent lah? Macam to explain.
For exam, and if com station and you know this is a AMC and something so the answer is yes. you need to do because you want to find the etiology. So you tell that the possibilities of the lesion in the any problem in the spine, the muscle. So for that we will do HMG.
Then we will do workout lah kan. Kita akan just cakap that we have to do the workout to rule out all those macam neuromuscular ke or syndromic cause lah kan macam tu.
To find the cause. Because the problem is that there is reduced movement intrauterine causing stiffness in at least 2 joints. Kan?
Betul.
That is the whole core of it lah. So you have to for exam and you have to actually, because the mother is asking what's going on actually, and then you have to tell the possible causes. Hence, this is the investigation we're going to do. But this will be done in stages, and we will inform you at every point lah.
Dr. Sitra, sorry like because in the question is not like mentioned about the amniotic fluid or reduced movement.
Yeah.
So do we need to ask some history while
Actually,
this?
Usually what they do is that you will tell this is the possible causes, then the mother will actually, so that to save time, the mother will tell you, yeah, I remember my fluid was reduced at some point, the doctor told me, or something like that. Usually they will you, as long as you say some keywords, they will assist you so that you can move forward.
Because I pernah tengok question macam dia memang dah cakap macam you cannot ask macam question from the mother macam tu kan? Ada ke?
You're not going to take
not history kan?
So you're just going to tell this the knowledge that you have, then the mother will fill in the gap for you. If the mother doesn't assist you, then you have to tell that so
possible lah.
We are still investigating like that. Because it's 9 minutes and you want to cover etiology, you want to cover of other manifestation, then you want to cover management, then you want to cover prognosis. So there's a lot of things you want to touch on, and they want to make sure that you actually go through that flow and then reassure the mother and be empathetic and able to convey your information, because sometimes the SP can actually purposely go on a tangent or very emotional or get loud. So start crying and stop, don't want to talk. So how are you going to tackle that? That's what they want to see. So sometimes they make it a bit more dramatic, but it's usually not so dramatic lah. The Asian one can be dramatic lah. Because like sometimes they give the student to the SP to actually like, okay, like say teenager or something, you're supposed to counsel for diabetic, and then he's just rude, he doesn't want to listen, or he's just not talking to you. You are trying to explain and it's just not responsive at all. And then you're supposed to still tackle and communicate, so they will see you how you do it, how you deal. That's communication station. It's not, don't be too pressured by the knowledge about a certain topic, but it's actually the flow that you want to make sure that you've covered. And are you empathetic? Can you recognize the mother is worried, the mother is anxious, the mother is angry, and then you can address those or not. That's the core thing in comms.
Okay. Macam pace tu dia macam kena laju sikit lah tadi kan, Dr. Sitra?
Actually okay. It's just that
it's slow
a bit slow, but some parts can go a bit faster, but it was okay because this is breaking bad news. There will be silent pauses. It won't be just total words. You give too much of facts also cannot. Then you're not empathetic, then they say like that. Comms is different a bit. So I think it was okay. If I cut at 9 minutes, you would have covered most of the things also.
Dia macam when the part the mom asking about the heart. Because macam yang saya baca macam the visceral organ tu not affected kan. So macam memang kita kena still offer macam some other test juga ke macam mana?
No. So what is the mother is worried about? Is there any other things that she must worry about? Because she's not seen this baby. Whether the heart is beating normal, is the face abnormal? You are not that the legs are not normal, but she cannot actually picture it. So you have, how are you going to reassure that part?
So we just reassure je lah, and that's why.
Imagine the patient like datang yang
like actually Dr. Sitra, you are like prompting Aniza to say something like we will look into it like by doing ultrasound. Is it like that?
Yeah.
We just make sure that there's no problem with your child. Usually there won't be any problem, but however, we will still arrange for the heart scan, like that, things like that.
Yeah, because sometimes these children can come with associated problems, so we will make sure that she's fine.
Oh, associated syndrome tu kan?
Yeah, I think like we can't be too sure that there's nothing, no problem with the visceral organ, but instead we have to offer just to make sure there is no problem. To offer.
Yes. So we sometimes they can be associated, but we will make sure that if she has a problem, we will do something about it lah. And we will get all the things involved. Which you said that part lah, the teams. Just that why you need all the things, it wasn't clear at the beginning. Then later you told orthopedic, physiotherapy and all that. Okay, it was good. So you should use some keywords also. Early intervention, programs where we can actually instill physiotherapy from a very early stage. You did use those words, but the phrases can be better lah. Sometimes some keywords make it more, they catch it, so that it is more appealing. Sometimes you say it, but it's a lot of words they cannot catch.
Contracture is medical jargon, is it?
Yeah, actually it is.
So it's
Dia dalam bahasa
fixed position, is it?
Fixed deformity or fixed stiffness, or you can say contracture, but which means that her limbs are so stiff that she can't even move it, and will need surgical release, and sometimes medication, right? That's what you will do, right? So yeah, that's the thing. Baclofen, right? We give. Yeah. So those kind of things. So all these things actually can. But how to organize your thought so that you will say that if that is a problem, we will do. She said about the feeding, the sucking, and you said that what we're going to do about it. Okay, recall back. What did you say about the sucking? You did say that you're concerned there might be some feeding problem. Then the mother asked whether can breastfeed or not. You said that maybe there will be some difficulty. So actually, would you let the mother try?
Yes.
Yeah, so as a pediatrician, we are pro breastfeeding and we want the bonding to happen. So we say that we will allow to try to breastfeed with supervision. But if there's any signs of choking or anything that shows that she's unable to suck well, then we might have to stop and opt for other options. Because you see, what they want to see is what type of pediatrician you want to be. The type that is pro breastfeeding, child protection, family support. You understand the dynamics of the family. So it's a holistic thing that they want to see. So these are the parameters that you want to instill. No matter what, so we are not going to cut down the chances of you to bond with your child. Okay, so that's how you're going to bond. So you say that we're going to give you an effort, we give you an attempt, but we will supervise and monitor closely. And if she fails to do that, which there might be, then we will have to do other ways of make sure she gets her nutrition lah. Yeah, so you might not need to tell everything like Ral's tube and all that. You can just be vague first, because it depends on how the mother reacts. Because if you say Ral's tube and the mother starts screaming, then what are you going to do? It's comms, comms. So not observe long case. So it's comms. So it has to be a bit more tactful. They want to see the tact in you.
Etc. Let's say if we don't know anything about this arthrogryposis, then we will like follow the flow, and then we will like congratulate and everything. Then we say that we will like refer to our consultant for further this one. But how do we like spend the the rest of the 9 minutes?
My suggestion would be that I would reassure her how normal the other things that I'm very convinced she is. That I've checked her lungs, I've checked her heart, I've examined her thoroughly. She doesn't have any other abnormalities that I could detect apart from her limb stiffness. And at this point, honestly, I'm not so sure what is the cause. But what would you do if you see something like that? First thing first, even if you don't know what's the diagnosis, you do an X-ray, right?
Yeah. Yeah.
Then you say, because I just want to make
true.
sure what's going on here. We are doing an X-ray to see how bad is the stiffness, or is there any kind of problems going on there. And then go back to basic lah. What do you do if you're on call and you get this thing that you've never seen before, and before you want to Google up, what would you do? The basic things. So you reassure about that. You say you're not sure what's going on. Then you think logically. You don't know what is this, but they said that there's some limb deformity, right? That's the stem that's given.
Yeah.
Okay, so you think, okay, limb deformity. So what's my approach for limb deformity?
Okay.
So I'm not so sure what's the problem. So then you say like it could be so many things. So you want to know further. Maybe we'll need to get some further history about what you ate and any kind of illness you had, those kind of things lah. Because we need to know what's going on.
Okay.
Then you cannot be so detailed on how you're going to manage, but you're going to tell what you're going to do now. Because the limb, so I will refer to ortho, because the limb, and I am not expert in this area, so I will ask my consultant to come in to see and help you out with this. And if needed, we will consult the genetic team. Dysmorphism is generally like that. You can't go wrong. If you say you don't know what it is and you want to consult the genetic team, and they tell you there's a congenital deformity, it's a safe bet lah. Kan? So do not panic, because there's so many things that can come out from the baby. The baby coming out from the womb can have so many things that we've never heard of. So yeah, it might be quite like that will put you in a panic and you cannot think already. So don't ever do that to yourself lah. Go back to.
So if we didn't know so much, we go vague lah, more vague things
yes,
lah.
more vague. And then,
more general things lah.
Yes, more general. And then you think, okay, like a child with deformity, you want to know about the family, what are the things that you're going to introduce. So to come back to the same things also. Physiotherapy, probably need surgery. It's no matter what, so limb deformity, that's what the things are, right? We will consult our colleagues in the other department to look into this and see what we can do. Let's see what else. If it's a dysmorphic baby, same also, right? We don't know what syndrome it is at this moment. However, we will investigate further. Let's say a baby who was born dysmorphic, special features, they say. They don't give a specific thing. They don't say it's Down syndrome. So still you will go about explaining it lah, that we found that your baby has some special features. We cannot identify a certain syndrome at this moment, but we are investigating further to identify if there's any other associated problems, and we will get the genetic team involved to find what kind of things and anything that we can do for her better, kan?
And then Dr. Sita, kalau macam in this kind of thing yang we don't know the syndromes kan, so we just give macam a vague plan, and including kalau kita nak cakap we will do some blood investigation, kita tak perlu mention pun what blood investigation tu boleh kan?
We just say we will send for genetic studies. It's better that when you say that you don't know but you're going to do the basic thing, it's safer than you become something. So if let's say you be safe and you say what is correct and it's not so wrong, because you're not so sure what it is, you may be from a fail to a pass. But if let's say, and if you tell what you know it is very surely, then you become from a good pass to a distinction. But if you goreng and it's bollocks, total nonsense that you're telling, from a pass you will just fail, because they don't like people who make up signs or giving stories that are not real. What is the word? Something about facts lah. Misconstrued facts or making up facts or something like that. This is from my knowledge lah. Okay. Want to try any other comms? What? Energy? 10 o'clock already. Okay, so we will do another comm session and then another time lah. Okay.
Tapi apa topik dia tu Dr. Sita?
So like communication, we have like information giving, breaking bad news, then
consent,
then procedure, like consent lah tu kan, kalau consent.
Pasal ada ni ethical punya ni Ethical.
Ethics.
Ethics.
And then lagi apa? Macam explaining procedures ke? Macam explaining macam lumbar puncture ke kan?
Yalah, that's consent kan?
Consent Consent.
Education ke apa ada ke?
Education ada
education
macam
je. Betul, dengan macam medical student, dengan nurse kan.
konflik pun ada.
Konflik
Konflik ada, like between two staffs who cannot get along or something.
Macam dia macam difficult conversation macam tu
Yes.
apa benda.
Ada. So nak buat yang mana?
Buat yang mana susah sikit je. Susah sikit.
Kalau semua susah.
Semua susah, tak apalah. Semua susah. Bagi kat.
Nanti I tengok dulu, I bagi tahu.
Okay.
Maybe
That's why I try.
Friday, Aniza has something. Next week, want to do Tuesday?
Friday actually boleh je.
Boleh ya.
Okay je.
Y'all just cakap-cakap lah dalam grup bila nak. Nanti kalau okay lah.
Tuesday pun boleh.
Datuk Sitra okay ke Friday macam?
Okay, boleh je.
Boleh
boleh.
Macam I okay je lah. I Selasa pun boleh, Friday pun boleh.
Sebab macam sejam je kan. Okay.
Okay. Cuma itulah Dr. Sitra bagi tahu topik dulu boleh prepare dulu.
Boleh. Nantilah saya tengok buku, nanti saya bagi tahu terus.
Okay.
Thank you so much Dr. Sitra.
Okay, thank you Dr. Sitra. Thank you.
Bye.
Thank you very much.
Hopeful pula.
Banyak bagus.
Banyak.
Kena buat program lah. Kena buat exam chart.
Dr. Sitra, I aim awal next year lah, I nak ambil exam pula.
Dia kena aim.
Sebab this year I macam bersalin kan. I don't think I can focus on that this year. But I want to like macam I nak start lah. I want to start here. I mean somewhere lah.
Kalau next year memang kena start dah sekarang dah. Kan intensive 10 months.
10 bulan kan? Tak cukup kan? Ni dah bulan 3.
Scary.
Bulan 2 next year Dr. Sitra. 1 bulan 10. 1 bulan 10.
Tak tahu lagi. I need a 10 months intensive juga.
Yang pregnancy korang ni. Cik Niza?
Ya.
Cik Niza dia nak beli rumah dulu.
Next year. Awal tahun depan.
Kita orang sekali lah bulan 2 sekali.
Dia kena sekali baru semangat.
Ya, that's why.
Gajian sekali.
Hopefully more patients come in, then you can acah-acah practice and do something.
Yeah.
Okay, boleh.
Okay, alright.
Okay.
Thank you so much.
Okay, thank you Dr. Sitra. Thank you.
Sekejap, Dr. Sitra.
Bye.
Dr. Sitra. Tadi kan, I'm recording kan. Tadi I ada terkeluar sekejap. Lepas tu like, I don't know whether it's like continuously recording.
Tapi dia tulis record lagi tau. Written here record.
So kalau I stop ni maksudnya dia akan ada lah kan?
Ada. Okay. So that it will come out on your Zoom, so it's easier for you all to watch. Because to share the file very difficult, besar.
Oh, okay.
Google Drive sometimes can.
Sekarang I try stop kan? I try stop.